Well, it's nice to meet
Call me
you.
Marie.
Okay, nice to meet you. Again, my name is Dr. Freeman, and it's nice to have you in clinic. How are you feeling today?
Well, since I had my accident 3 years ago,
Yes, ma'am.
I have chronic back pain, low back pain. And I take the meds just to help me get through my day.
Tell me about your back pain.
I slipped on the floor when I was working back at HEB, and they put me on Norco right away. So that's the only med that I've been taking ever since. It gets me through. I mean, it's not perfect, and I have pain still, but it's enough so that at least I'm not screaming in pain all day.
And you take your Norco
4 times a day.
4 times a day. 2 pills?
Mm-hmm.
4 times a day. Has anyone ever done any workup to see what might be causing it?
I had an MRI done, I think soon after it happened, and it showed some collapsed discs.
Yes, ma'am.
And I was seeing a back specialist then, so looking at physical therapy. I don't know that it worked. But what I remember he did was he tried to get me off of Norco, and that didn't work. So.
What were you doing at that time that he was trying to do to help you get off the Norco?
Just some physical therapy trying to get me to, because I can't walk for any length of time. And if I stand for too long, it starts to ache again. So he was trying to get me to, I guess, be more functional because I can't go to work still.
And I know your pain when you lift your leg, it kind of runs down the back of your leg.
Mm-hmm.
Tell me a little bit about your pain. Where does it hurt you?
The lower back, and it's just a dull ache
All the time.
all the time.
And is it kind of on the sides of your mid-back or right midline?
Right in the middle, and then the sides of it.
Sides.
Just there.
Is there ever a time when you don't have pain?
Not that I can remember in the last 3 years.
Okay. And no other issues that you've been experiencing, like, that you know of?
I don't think so.
No. Let me ask you a couple questions that may seem unrelated, but will help me in taking care of you. Has anyone in your family ever struggled with alcohol or drug use or tobacco use?
My father.
Your father? Tell me about him.
He died when he was 60. He was an alcoholic.
Really?
He had cirrhosis by the time he died. So he was.
Sorry to hear that.
That was hard to live through. I mean, it's difficult living with someone like that.
What about you? Do you drink alcohol?
No.
No.
I think that's what turned me off.
Really? Do you smoke cigarettes?
No.
No. Do you do any drugs?
No.
No. And how about your maybe like your state of mind? How do you feel like you look out on the world? Do you feel like you have
Like now,
you feel
I'm
depressed?
sitting here and I'm looking at the window and I'm behind the window. I cannot join the world.
Why do you think you feel that way?
I can't do anything. I can't even bowl. I can't even crochet for any length of time. It's so hard.
Do you feel like this issue is making you depressed?
Yeah.
Really?
It's headed me towards that. I'm trying not to. I mean, I try to keep in touch with my sister. I used to see her a lot. You know, play with her kids.
Yeah.
It's difficult. I mean, I'm no fun because I'm in pain all the time, so they don't want to be around me.
Do you have any history of anxiety or bipolar disorder?
No, I was very fine before. I was happy, getting along well with my sister, and saw her kids all the time, you know, I used to play. I don't like seeing them too much now. It just makes me sad.
Yeah, I understand. Let me talk to you about let's focus on your pain. I want to help you with your pain. I want to help you feel better. And if we could help you feel better from that perspective, maybe we can make you feel better inside too.
I would like to feel better.
So here's one question I have for you. How do you feel about the Norco? Is that a medicine you think you have to have, or if we could control your pain in other ways, how do you feel about it?
He was the first thing that they gave me within days of my getting hurt. And at the time, it really helped me.
Yes, ma'am.
But now, like today, even with the Norco, I still have pain. It's not like I'm pain-free. It just makes it bearable. But I know the pain is still there.
So let me see if I understand. Initially, the Norco helped you quite a bit. And then after a bit of time, it didn't help anymore. And now you have pain all the time.
Yeah.
Sometimes with medicines like Norco that have those opioid medicines in them, like hydrocodone, that can happen. They're really not good for a long-term pain. They're good for that short-term pain, like you experienced. Right away, you felt that relief. But they really don't help people so much with long-term pain.
So why are they giving it to me?
That's a good question. And I think it's one that we can work on together, is seeing if we can come up with a better way to control your pain. I don't necessarily think we need to stop your Norco immediately. We can kind of gradually taper it down.
Okay.
And I think there's other things we can do to control your pain better.
Like?
I know you tried the physical therapy in the past. I think that in combination with other things, it might be worthwhile to try it again. And we can try a different physical therapist and see if that makes a difference. I think that as well, you know, when you're at home, you've tried walking and that's hard on you. Have you tried swimming or riding your bicycle?
The thought of riding a bicycle. Maybe
swimming.
Maybe swimming.
Maybe swimming.
Yeah.
So maybe you're a swimming person.
Yeah.
You know, exercise can really help with chronic pain, especially back pain. It can really help. And I think it'd be worth trying, you know, 4 or 5 days a week, going to the gym, going for a swim, going to the Y and having a swim might help. It seems like it wouldn't. But I've had some people say that it might help. And I think that might help. Also, we can try other forms of pain medications that are not necessarily these opioid pain meds that don't really help for chronic pain as much as other things.
I don't know, because just walking from here to there is a pain, and the thought of doing even more exercise, it's like, oh my God.
It's challenging. It's a difficult thing. I'd like to see if we could make a difference in your back pain through exercise, physical therapy, and also, it sounds crazy, but weight loss really helps with chronic pain. A lot of people who have joint pain, knee pain, have any kind of back pain, actually losing weight makes a big difference.
I have gained a lot of weight in 3 years that haven't worked. So depressing.
Maybe that would also help you feel better about everything else. And I'd love to help you develop a good nutrition plan and a good exercise plan to help you lose weight and to help you feel better and more than just the pain way. Do you think maybe we could work on this together?
I'd like to try. I'll try anything. I just don't know if I can live with pain for.
I don't want you to.
Yeah.
I don't want you to. Let's come up with a plan together.
Okay.
So number 1, we're going to increase swimming. Like what? You can do it.
Okay.
You can do it.
Slowly.
Slowly. Let's have a goal of trying to get you swimming 4 or 5 times a week.
Oh, gosh.
If you think you can handle it. And if not, we can come up with other activities together. Number 2, I'd like to bring you back and talk to you about good, healthy eating and continue to work on nutrition. And
I guess snatching in front of the TV doesn't help.
probably not. So I'd like to talk about nutrition with you, and we can do that sometime next week.
Okay.
And really get you on a good eating plan so that you can lose weight. And we can even make a goal. By New Year's, we lose 5 pounds. We can make goals like this, just little goals that help us work together and stay on track. And number 3, I'd like to see if we can taper down on the Norco. Because it doesn't sound like it's helping you that much.
But what else is there? I mean, if I was not to take it, I would just be in more pain.
I understand. And there are medications like, for instance, ibuprofen that can be very helpful in back pain. And I'd like to maybe start trying to use some of those things instead of the Norco and see if it helps you more.
You know, you're the doctor, as long as it doesn't hurt more.
I understand the concern and the frustration. If you're willing to try this with me, I think it'd be worth trying. What do you think?
We'll try it for a while and see if it works. If it works.
So, we can do 1 more month of the Norco.
Okay.
And then when you come back and see me, as you taper down off the Norco, we can start adding back other medications like ibuprofen to see if that helps. And I'm not going to abandon you in this quest. We're going to keep working together until we get this under control.
So it'll be like, you'll cut it down.
And
But
then
if I can't manage the pain, you can add to it again.
yes, ma'am. We can add back different medications that are better with chronic pain and better with chronic issues. And we can work together and have good communication between the two of us to make sure that you don't feel abandoned and in more pain.
Okay. At this point, I'd like to try something.
I think this is a good plan. What do you think?
I'll try it. I'll try it.
I appreciate you working with me, and I think together, maybe we can get you feeling better and we can get your pain better controlled.
I'd like to start feeling better. It's no fun being like this.
I can understand that.
But useless and can't even work and can't do anything.
I think that we can make a difference in this. So we're going to start swimming as much as possible. I'm going to physical therapy. I'll put in that referral, and then you and I will start working together on weight loss and good diet, nutrition, and maybe see a nutritionist if we still need help.
Okay.
And then we're going to come back and see you I'll bring you back in 2 weeks. And I'll write out a plan for you on how to taper down the Norco and what medicines you can add over the counter and at what rate.
End of encounter.
Okay.
Please step out to the
Okay?
hall.
Okay.
End
It's nice
of
to meet you.
encounter. Please step
Thank
out
you.
to the
Of
hall.
course.
Patients, please return for feedback. Patients, please return for feedback.
Again?
I have a lot of questions.
I know, there was just a lot. How do you feel this way?
Well, I think that it's a good station. It's a good thing to go over because it happens a lot. You know, we have a lot of people that have chronic pain, so it's a good thing to review and go over and learn from.
Yeah, well, they just wanted us to just go over with you with the risk factors for narcotic misuse. So you did ask about my family history of alcohol and drug abuse, my father. And then you also need to find out about my personal history for use alcohol. And there's supposed to be a question about my history of pre-adolescent sexual abuse.
Yeah, I forgot that one.
Yeah.
I reviewed it, but I forgot that one. I'm sorry.
And then my personal history of mental illness. So do you have any questions for me?
Yeah, was there anything else we were supposed to ask you or anything else we were supposed to do?
Just that,
The screening.
yeah, screening for sexual abuse and then my personal history of mental illness. And, well, you got the part about my dad. But, and then there was supposed to be a contract for the narcotics.
Like a signed contract.
Well, you bring it up, that there's a contract and then you're expected to have urine testing every week. But I don't know, you weren't starting with the,
I ran out of time.
yeah, so we probably just ran out of time. But yeah, they expect you to
Have
offer
a
that,
contract with your
you'll continue the drugs, but either take them,
1 minute warning
switch it
for
out,
all
but
stations.
have a contract in
1
place.
minute warning for all stations.
I felt like you cared for me. You made me feel like you weren't just going to refill the prescription like a robot and just here for your pain. So you gave me an alternative lifestyle. It doesn't have to be this way. But there is something else. Because 3 years, all they do is refill. So I need something else.
Thanks for taking the time to do this.
Oh, sure. I was swimming. What did I do?
I don't think I could swim. I don't think what. The shower, that's about it. I think I can do the biking though. No, you don't like biking? No. My husband bikes like it's going out of style. But, I don't think
See, I can't bike.
Really?
Fall.
Oh, really?
I've done the swim. I went for the swim.
Sometimes you can get on these free programs with the Y. You get like free lessons and stuff.
I am with the Y.
Ask him about it.
I do the swimming. I don't like it.